Our next session comes from someone that you've also served with and have high regard for.
Not served with her, but I have high regards for Annie Alaniz. She's an obstetric gynecologist surgeon here in town, and she's from Malawi. She's going to tell her story. And I can tell you, Chuck, that of all the sessions that I've heard of at M3 over the 6 years, this is one of the most impactful sessions that I've ever heard. And there's rarely a time that I watch it or listen to it that I don't cry. So I think people are going to really enjoy this. It's just the story of a village girl who came out of Malawi and is now making a difference in the very village where she came from.
Hello, I'm actually still in shock that I'm standing here today to speak to all of you. I'm one of those people that on any given day, if you put me in a room with highly educated people, very accomplished individuals, I just find myself intimidated. I start to shrink and I start to convince myself that I don't belong to that club. This actually happened a year ago, the first time that I met Dr. Paul Osteen. I had attended a luncheon for medical missions where he was in attendance. I'd been invited by my friend, who's also a nurse, Morgan Fisher, who came to Malawi with me on one of our medical mission trips. She was going to introduce me to the people at her hospital who helped sponsor her trip to Malawi. I was asked to speak for about 5 minutes on our work in Malawi at a round table with people who were doing similar things. I remember listening to everybody talk about the wonderful things that they had done and what they had accomplished. And very quickly, I realized how small I was, how small our organization was, and how far we still have to go. And I wasn't really sure that it would ever get there. Nevertheless, I gave my little 5-minute synopsis of what we were doing and spent the rest of the meeting taking notes from people that knew everything that I didn't know. At the end of the meeting, I saw Dr. Paul Osteen walk towards our direction. I just assumed it was probably somebody right behind me or right next to me that he was most likely going to be speaking to because they had more important and innovative things to share with him. To my surprise, though, he walked right up to me and Morgan, introduced himself, and asked us to attend this very conference last year. He added a booth for Portawera that we could actually exhibit in the hall. It is a moment like that, and really a moment like this one today, where I'm standing on this stage that reminds me that God reminds me that who I am is not defined by me or people around me or circumstances around me, but by God himself. It's because of God that a young girl who grew up in a small village in Tonje, Malawi, with no promises of a bright future, found herself in the United States of America, living her dream as a gynecologic oncologist. And I'm now standing here in front of you, truly humbled and truly honored by God's grace. Even my coolest dreams when I was a kid were not this cool. I was born in Malawi and I was the oldest of 8 children. If you're wondering where Malawi is recently, after Madonna adopted her babies, I just tell people that's where Madonna's babies came from. And somehow that seems to change the whole geographical location of Malawi. So if you didn't know, it's where Madonna's babies came from. I spent my childhood in a small village called Tonje. Like most villages, Tonje was plagued with poverty, disease, lack of access to basic needs of life. I attended most of my primary school under a tree. The most accessible transport out of Tonje were my feet. And on a really good day, I would get a donkey cart, maybe an ox cart, and sometimes even a bicycle. I was all grown up by the time I was 10 years old, and I started assuming adult roles. This was an imperative thing for my mother to do, as it is for many mothers in Malawi. Because while death is unwelcome, it's an expected outcome for most young mothers, especially during the childbearing years. My mother had to make sure I was ready to take over the family. This is a reality for many young girls in Malawi. Meet Mary and Timothy. 3 years ago, 13-year-old Mary walked a long way from her village with her brother Timothy to an HIV clinic where her mother used to receive treatment. She came there to return the prescriptions that her mother would no longer need because she had passed away. Her brother had malaria and severe anemia requiring blood transfusion. Mary became Timothy's mother at the age of 13. She did all the bedside care. She always made sure that Timothy would eat before she did, even if it meant she didn't get anything to eat. She literally nursed her little brother back to health. The sharp medical clinicians in the HIV clinic decided to follow up with Timothy and Mary after they were discharged and soon realized that the children were on their own and their community would not or could not care for them. Mary was often beaten, and that smile was quickly gone. She had health problems of her own, and in despair, she stopped taking her medications, hoping that her disease would progress and end her misery. Through contact with some good missionary doctor friends, there was a happy ending for Mary and Timothy because they are now at Potawila, thriving and attending school. My life in Tonje had similar stories. We struggled for everything, including clean water. We shared our drinking water with cows, goats, and dogs. When the rains would fail, we would dig in the sand until we reached some water and waited hours just to fill one bucket. I still get overwhelmed when I watch my kids, who are about the same age that I was, when I take them to the beach and they're digging around in the sand for water just for the fun of it. I felt hungry most of my life. With droughts, our crops would fail and food would become scarce. I remember seeing trucks carrying bags that had red, white, and blue colors on them with corn. We would stand in long lines waiting to make it to the front of the line and hoping we would make it to the front before they ran out. And sometimes the corn would run out, and I would watch mothers with babies strapped to their backs, flock to the front, sobbing and begging for any little leftover corn so they could at least just feed the babies. These were moments that I wondered if God had forgotten that there were still people living in Tonje. My dad was an educated man, and most educated people I knew chose to live in the city where things were more accessible. I never understood why what my father's reasons were for always choosing the road less traveled. He would often remind me that God wanted us in Tonje, that God had a plan for us there. He would often quote Jeremiah 29:11, "For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future." This was always worth an eye roll from me. And I actually rewarded his sentiment by telling him I was going to refuse every marriage proposal from a boy that wanted to be a pastor. At the age of 14, I was the first student after a decade from Tonje Primary School to be selected to 9th grade with a full scholarship to a prestigious boarding school in Blantyre. I was the pride of my village and the pride of my parents. I packed my small cardboard suitcase with 3 outfits, my school uniform, and my very first pair of leather shoes, which my dad bought after selling some bags of beans at the market. When I reached Blantyre Secondary School, I realized I didn't feel like I belonged there. Most of the kids hadn't had the kind of experience that I had. They were dropped off in cars, and I had to rode a bus to school, got off the bus stop, and walked right into campus with my little suitcase. It was a hard place for me to find where I belonged. I also knew, though, I needed to stay in school because this was the only place that would give me the dream of becoming a doctor. And that's the only thing I had in my hands. I decided to start looking for my dad's God. And guess what? Jeremiah 29:11. But this time it carried a weight that it never did before. I hung on to this verse and it became my anthem through high school. This is why the Bible tells us in Proverbs 26, train up a child in the way that he should go, and when he's old, he will not depart from it. In 1994, Donna Ivy, an ER doctor from a small town, Poolville, Texas, came to Malawi, worked with my family, and while she was on a short-term medical missions, very quickly she realized of the overwhelming lack of resources, well-trained medical personnel, and knew that in 2 weeks she couldn't make much of a difference. She realized, however, in her hands, she had money and she had a country that could provide access to education for a little girl with a dream. On July 4th, 1994, I landed at Dallas-Fort Worth Airport with a full scholarship from Donna to attend college in the United States. It was an out-of-body experience for me. So many buildings, massive highways, 16-year-olds with cars, lots of white people. I had never seen so many white people. This was the land of milk and honey. There were huge stores called Walmart that had everything I could think of and everything I couldn't think of. They had entire stores dedicated to pets. I attended a Sunday school class with Donna Ivy, where grown women in a Sunday school class were learning the symptoms of hunger. They wanted to learn how to eat only when they were hungry so they would lose weight. Imagine my shock when I had felt hungry my whole life. After my first year of college, I went back to Malawi for a visit. As the plane was approaching Lilongwe International Airport, I looked out the window and noted the vast, empty, underdeveloped nature of my country, very different from DFW when I was landing in the United States. There were dirt roads, small huts, large open fields. My life had changed so drastically, and yet my home was much the same. I went to watch my father work in the clinic and became acutely aware of how little he had to treat people who were severely ill. I saw a young, otherwise healthy girl who had a bout of diarrhea for a few days. By the time her mother made it to the clinic on foot, the little child was extremely dehydrated. The clinic had no IV fluids. She was too sick to drink. She died from dehydration. I watched my dad help her mother strap the lifeless little girl's body on her mother's back to start a long walk back home with her baby girl. I went to the district hospital and saw women laying on trash bags on cement floors, delivering their babies because the hospital was overcrowded, understaffed, and under-resourced. I saw women hemorrhaging while on the floor holding their newborn babies, and there was no blood to give them because the blood bank was empty. I realized that little girl that went home dead could have been me. I realized that the women laying on the floor dying while giving birth was the future that was once mine. Somehow God had found me in the midst of all this, chosen me, spared me, and I was now in the United States, a land where my dreams to be a doctor could actually come true. Sorry. That was the birth of the awareness of the plight of my country. And it was also the birth of a new dream. I had to search for my purpose. I started to ask God, why me? What can I do? I'm a stranger in the United States of America with minimal connections. I'm still just a village girl with empty hands. Exodus 3:11, Moses at the burning bush says to God, who am I? And in chapter 4:2, God says to Moses, what's in your hands? And he says, a staff. And the rest of that story is history. All God needed was for Moses to say yes. And God would use whatever Moses had, no matter how small, to fulfill his purpose. I finally decided to just say, yes, here I am, send me. While in medical school, a group of friends of mine from the Christian Medical and Dental Society group collected a few items. We set up a garage sale and sold $1,500 worth of items. We found a matching donor at the garage sale, and with $3,000, I bought land outside of Salima, Malawi. This was a way to solidify that I was willing to go where God wanted me to go. I had no means, no money, but just believed that one day the land would be used. 7 years later, the land became home to Port Tawera Safe Haven Christian Mission Organization. Port Tawera has a home-style orphanage with 126 children, 12 widowed mamas who have now children to love and care for. We have a school with over 300 children from the village and from the orphanage who wouldn't have access to education. We have a medical clinic that sees 200 to 250 patients a day, and we'll soon be opening a birthing center. We have agricultural programs where we're growing food to feed the kids. We have chicken, goats for meat, which I generally have to convince our visitors not to name the goats because dinner won't taste that good. We will soon construct a high school and start technical training to develop higher educational opportunities. I once heard someone say developing countries are made up of entrepreneurs, visionaries who with social justice and equity have the capacity to be part of the economic development of their countries. This is Joseph to the left. His dream is to own a real sound system one day. For now, though, he has created a stereo sound system from electric wires he collected from the trash, an old plastic water tank, and an old radio that he repaired and placed his own wire antenna, and he powers it with a smaller solar panel. He brings this to school. I'm not sure the teachers are too excited about loud music at recess. To the right are a group of young men who've somehow figured out how to create a pool table from sticks and mud. This is the creativity and innovative minds that I see in all the children that we have at Portaria, because that's also what God saw in me, even when I thought I was forgotten. As the project grew and the demands of the finances increased, I found myself overwhelmed once again about the responsibility it has taken. I kind of asked myself, I've been grown since I was 10. Why can't I just be normal? Why can't I just be less responsible? I looked at God and asked how he wanted me to do this. I reminded God that I have no roots in the United States, that I have no financial resources from Malawi, and I was definitely not Oprah. The fear of failure became real as the burdens increased. Through an amazing friendship that could only be driven by God, I met Mike Novolio, who was raising money to repair wells in Malawi by climbing Kilimanjaro through Child Legacy International Organization. What are the chances that Mike and I would meet in the woodlands? Mike used the vision that God had given him to support his ministry, which he had done successfully for years, to empower me to find a way to create visibility for Portaria. In 2016, along with my friend Mike and Clean Water Climb, I used the feet that had walked and run many miles in Tonje and the stamina that helped me carry 40 pounds of water on my head to climb and summit Kilimanjaro for my fellow Malawians. It was the hardest thing I had ever done, but the most physical expression I could give to God, that I was willing for him to use me and whatever I had in my hands, however way he saw fit, to benefit my people in Malawi. This platform has been transforming, for better or worse. I've done it 3 times, and I'm about to go back again for the 4th time this summer. I'm truly grateful for the feet and hands and stamina to do this, and truly grateful for my friend Mike and Jennifer, who instead of choosing the success of just their own ministry alone, decided to use what he had in his hand to help me make my own waves. And here's Mike. When I look at my life, it is filled with a series of people who used what was in their hands to fulfill God's purpose in my life. My parents' selfless love for the service of others, Donna's financial resources and access to higher education, and Mike's success with his own ministry used to empower mine. Life takes us through different seasons, but God will use each one of us when we think we have nothing to give. David was a shepherd boy who had a sling that God used to take down a giant. Ruth was a hardworking widow who had lost everything, was in a strange land, gleaning in a field for food, and later became the owner of that field through marriage to Boaz. We serve a living God, a God of unmerited favor who turns things around for his glory. Nothing is impossible with God. If you're hearing this call this weekend, don't worry about what you don't have in your hands. because God already knows what you have. Just say yes.
Okay, got it.
Dr. Paul, I understand why you were so excited about that talk. That was compelling. What an incredible story. I thought, if you don't mind, maybe you can introduce our special guest for this
Yeah,
Q&A
this is Dr.
segment.
Annie Alaniz, and we're so glad you're here today. Annie, thanks for taking the time. Your busy schedule to be here.
Thank you for having me.
Yeah. You know, Annie, so many parts of that talk just really tugged at my heart because people don't understand what it's like to live in under-resourced areas. And when you made the statement that I was hungry for most of my life, that's a really reality, isn't it?
It is a real reality. That's why for me, it was an out of body experience when I went to the Sunday school class and there were women who were 50, 60 years old wanting to know what hunger pain felt like. And, it was something that was all too familiar to me.
Yeah.
I was hungry all the time. I was hungry most of the time. Nobody needed to tell me what that feeling was like. So to know that there are actually people here that have grown up an entire lifetime and I have never felt a sensation of hunger, when I know many children like myself in Malawi, that's something that they feel every single day. And even when you eat, you just eat just enough to survive, not to where you're just so full that you have no hunger sensation.
Yeah.
And so it is incredible to live in conditions where the basic needs of life sometimes are just not available.
And then extrapolate that out to healthcare. And
Yes.
you can imagine Malawi is always ranked one of the lowest countries as far as healthcare.
Yes.
Is that not right?
That is very accurate. And one of the things that we have even access to healthcare, especially in the villages, most people don't have, modern transportation. So they have to walk 15, sometimes 20 miles to get to the hospitals. I remember on one of my trips that I had gone about 2 years ago, there was a young woman who had a complication of surgery where the incision came open. And she literally took one of the chitenjes, which is the wrap that you put over. And because there was no 911 to call, she essentially held some of her internal organs in the chitenje, rode a bicycle for about 25 miles to come to the district hospital. And that is what most people face every day because of lack of access.
Annie, this statistic, but Lancet came out several years ago, 5 billion people in the world don't have access to safe, timely, affordable surgery.
Yes.
And that's very much the case in Malawi.
Yes. And it's very much, I'm a gynecological oncologist here. So when I go to Malawi, because of the level of training that I've had, even though when I'm in the US, I focus very much on, women, gynecological oncology, cancer. When I go to Malawi, I'm a general surgeon. I've participated in amputations. I'm able to really use my skills at a wide level because the specialty of surgery is just not there. Generally, like a Salima District Hospital, which is a catchment of about 500,000 people, they have one physician who's on staff. And so he's not going to be available to take care of 500,000 people.
Is he a trained surgeon?
No, he's a general practitioner. Most of them really, they, finish medical school. They usually do 1 to 2 years of rotation. And some of the general surgery residencies are coming in. But for now, most people that are doing surgeries don't have a subspecialty training in surgery. They've had to learn on the spot. They've had to learn because of the necessity.
It's one of the reasons I'm really excited about a new venture you have there at Potawera, and that is your birthing center.
Yes.
How close are you to having that ready?
So it's actually completed. It's furnished. It's ready to go. But because of COVID, it kind of delayed. We should have already been running for a year because when we did M3 conference last year, we were on the verge of opening. But then that's when COVID came. And, everything was closed and there were some restrictions in terms of them being able to come in and out. And so now we're actually, restarting that process. And I think probably in the next few weeks, we should have, the Minister of Health come by and do their inspection and get our approval. And hopefully we'll open here in the next month or two.
Will you be able to do C-sections then?
So we don't have the ability to do C-sections yet. That is one of the things I very much would like to be able to do. So that will be phase 2 of what we'll do. So we have a relationship right now with Salima District Hospital. They have 2 operating rooms there. And so we've met with the GHO, and the goal is to try to make sure that our relationship is such that if we have a patient who needs emergency, C-section, that we're able to get them there.
That's so good.
We have an ambulance. There was a group of OBGYN physicians, actually. There are physician moms that are also OBGYNs. It's called OMG, OBGYN Moms Group. They actually donated $32,000 where we bought the ambulance that actually specific to the birthing center. So I'm looking forward to being able to put that to use.
When I was in Malawi last time, there was no petrol. Is there petrol now?
There is petrol now, but we have ups and downs with petrol. Yes, we have an interesting relationship with petrol.
People don't realize you can have an ambulance, but if you have no petrol, you can't get a woman for a C-section.
Exactly. And sometimes even electricity is an issue.
Exactly.
Blackouts are very common. I remember one of the trips that we made there was a woman waiting to have a repeat C-sections because she had had multiple C-sections before. She was outside the operating room in labor, in pain. There was no electricity. And eventually, she had a complication of a uterine rupture while waiting to be able to get electricity. And because we're out of petrol, they couldn't actually, get the generator to kick in. So those are some of the things that are, constant barriers and things that you're trying to swim through as you're just providing basic.
You've said it well, but that's the reality for most of the people in Malawi.
That is reality for most of the people in Malawi. Because Salima District Hospital is located sort of where 90% of the population of Malawi live, which is in the villages. So the experience in Salima is very much the experience of most people that live in villages and low resource parts of Malawi.
I think we may have some questions from the audience.
We do, as a matter of fact. In fact, one of them, I think, is a great segue into what you were just talking about, Dr. Alaniz, and it was the balance for you and your work and your practice, the balance between what you do here and in Malawi. How do you keep that balance in shape?
So the balance is definitely very challenging. Number one, I am incredibly grateful for a husband who is very supportive because when I leave, and I have to go to Malawi, then he's in charge of taking care of the kids. He's my other half. I don't think I would be able to do what I do if I didn't have somebody who was, supportive and truly shares this dream with me. And so the balance actually works out because there's a symbiotic relationship between what I do here in the United States and what I do in Malawi. It is what I do here that actually provides some of the financial support for what's in Malawi. So even when I'm here, I'm actually still actively working in Malawi because the people on the ground would not be able to do what they're able to do if I didn't have the resources that I use here on the ground. Recently we just did a 100-mile hike in 4 days in Lone Star Hiking Trail. An incredible group of people came alongside us. They donated. We raised $90,000. So even though I didn't get to go to Malawi, there's $90,000 that's going to be going this year to help them keep the birthing center going, to keep the clinic going, to keep the orphanage going. So I think the balance there, I try not to feel like my presence here means I'm missing something in Malawi, because when I'm here, I'm working for Malawi. And when I'm in Malawi, it's the same, thing. So, but yeah, I guess. In short.
That's brilliant. In some ways, you sort of answered this question because ministry and missions is still going on even while you're here. But I thought it was an interesting question. Do you believe that missions in Malawi will resume in 2021 or 2022?
So I'm vaccinated now. So I may make a trip to Malawi this year. Hopefully my hospital will let me make a trip to Malawi this year. I think they'll let us travel, but we may have to come back in quarantine after. But I don't know that I will take a large group yet. Probably in 2021, when more people have been vaccinated and we have more of the herd immunity, 2022 will probably be more feasible for a larger group. But I think this year, if I go, probably a party of one, maybe 2 or 3.
No, I understand. We have a special guest that's going to join us in just a minute, but before she does, another question. How does one partner with an existing medical clinic in Malawi to provide resources and sustainability to the surrounding villages instead of creating something new?
So, this is one of the things that I believe in, because I think a lot of people feel like when they go somewhere, they have to start something new. A lot of times, if you look around, you find that there are people working and they're already doing things. And some people are lacking resources. Some people are lacking just additional manpower, right? Because the work is plenty, but the workers are very few. And so I do think it's very important when you go to a new place to try to figure out what are the things that are already in place and who can you come alongside with. There's a notion sometimes that people think that the reason why countries in Africa or countries like Malawi are behind is because there are no people there who have the capacity to change the course of their country. But the truth of the matter is there are a lot of people like myself, my sisters, my brother, who are fully capable of being able to have ideas that can actually change the course of how our country runs. I think coming alongside them is very much what people need. So I think when you go to a place or you attend maybe one of these conferences, I think one of the biggest things to take out of it is look around, and see what groups are involved here, which countries you're interested in going, and then start off by just joining someone who's already doing something. Yeah. And then usually that's how you figure out where you belong. But I definitely agree that I think starting something new, unless there's no resources available, isn't always the way to go.
Yeah.
So, and I know a clinic, so find me.
Yes.
I was going to ask if people wanted to find out more about your clinic and your ministry, how would they do that?
So we have a website. The spelling may be a little bit difficult. It's www.potawira.org, POTHAWIRA.org.
And that is on our exhibitor list too. So all you have to do is go to the exhibitor list, find that, and it's hyperlinked to her website.
Yeah, and it's got information about trips. I've done yearly Kilimanjaro climbs for fundraisers for those people out there that are adventurous and want to be able to climb the Kilimanjaro for a good cause. That's one of the things that's there. So hopefully we'll have a big Kilimanjaro trip in 2022. Again, if there's one this year, it'll probably be a party one of two. But there'll be more information there on how you can connect with us. And there's an email address, and we try to communicate with people that are interested and plug them into areas that they will be interested in participating.
Okay.
Yeah.
Well, I thought we would wrap up this Q&A session with a very special guest, Sandra, who is joining us now. Sandra, welcome. It is so good to have you here.
Thank you so much. I'm glad to be here.
I love your story, and I love how you and Dr. Alaniz have connected, and I love where you're going and what you're going to be doing. Why don't you share with our audience a little bit about that?
Well, it's very interesting because I was probably around 2015, I just had this big press on my heart that I needed to go serve long-term. And so I was just like, okay, Lord, I hear you. Now, how do I start this process? Like, where do I go serve? And so, of course, working here with the Medical Missions Conference, with M3, it was like, okay, there's tons of exhibitors, tons of different mission organizations I could serve with, but I just didn't have a specific one in my heart. And so during the 2019 conference, I had made a promise to myself that I would, after I finished my duties, I would go ahead to all the exhibitors and find the right mission organization to serve with. Well, of course, being the conference and being as busy as it is, I didn't get the opportunity to go to those different mission organizations to check them out. So I went ahead and I went into the last plenary session, and Dr. Alaniz was speaking. And so I had already heard her presentation. She sent it in to me. I'm the speaker coordinator. So I'd seen her presentation. I just hadn't heard her speak it. But when I was listening to her presentation, I could have sworn I heard God say it. He said just very clearly to me, this is where you need to go serve. And so I was like, oh my goodness. And at the exact same moment that I heard that message from God, I had a text message from one of my friends who was also in the audience. And she said, I think you need to go serve here. So that started the process. And I spoke with Dr. Alaniz, and I planned a mission trip to go there. Well, of course, in April, that's when I was supposed to go, April of 2020, and COVID happened. My flight was canceled. I was all ready to go, but the airline was not ready for me to fly. So we had a slight delay, and then November, but actually in September, we were doing a fundraiser. And so we were hiking the Lone Star hiking trail here in Conroe. But after that hiking trail, again, I heard the Lord say, it's time to go now. Go ahead and go now. So I spoke with Dr. Alaniz and I said, I feel like it's time for me to go now. And she was very surprised, in the midst of COVID, you want to go and serve in Malawi. And so we went ahead and we set everything up. And I even remember my sister saying, I can't believe you're going now. And when she said going now, she meant you're going in the middle of COVID. And I didn't even think about it. And it was all of a sudden when my sister said that, it hit me. I'm like, oh my goodness, it is COVID. But when God told me to go, that's all I knew. And so I just went ahead and made the plans and started working towards that. And even after that realization hit me that I was going in the middle of COVID, I knew it was God's plan and I knew he was going to provide and cover me during that time. And it was a wonderful, beautiful, successful trip. So that's
What's
my
your
story.
future?
What's my future?
Yeah.
Yes. What are you going to do when you grow up?
What am I gonna Well, right now, I'm definitely praying about serving long-term at Poteria.
Yeah.
So we will soon see.
Yes, we've been talking.
Beautiful.
We have been talking, yes.
We're excited for you.
Yeah.
And really, it's just amazing to me to see, that's the goal of M3 is to mobilize people to missions.
Yes.
Yes.
And one of our very own has been mobilized to go.
Yeah, did you think you were gonna-
I don't know
Yeah.
how you. I don't know how you feel about
You've
it.
stolen her.
But she's been mobilized.
Well, actually, Dr. Paul,
that is what you wanted.
it's actually his fault.
It
That's
is
right.
his
It's
fault.
my
That's
fault.
what I said. I don't know how he feels. It's like I wasn't trying to mobilize you. I want to mobilize everybody
Right.
else, not my right-handed person.
Right? Because,
Well, it was a good day.
Serving long-term has always been on my heart. And this being involved with M3 conference has definitely even made it more of a pressing
Yeah.
thing for me to do, like for God to say that this is something I'm asking you to do. I'm glad that you're serving missions in this way, but
Yes.
that's partial obedience and I need you to do full
Yeah,
obedience.
it's beautiful.
So
It was a good day when I met Dr. Alaniz at that luncheon. And
Yes.
it's a great day to know that you're going to do what you're going to do too. So we
Exactly.
congratulate you and we send you on your way whenever God leads you to.
Oh,
We're
thank
excited
you.
for you.
Thank you.
Thank you.
Paul, I find it interesting that it's a full circle moment
It
right
is,
here.
it is.
I mean, when you think about the heart and the mission of M3, that's what it's really all about. You may not have known one of your own team was going to lose, but I think it's just such an incredible testimony to what God is doing in the world.
Yes.
And a lot of that is happening right here at M3. In fact, while you're here, we want to encourage you, make and take advantage of all of the resources that we have available.
Mhm.
Find some of these ministries, just like Sandra did, to connect. Find a place where you can serve and that feels like this might be now is the time for you to go,
Yes.
even in the midst of a global pandemic. We have some incredible resources for you and available. In fact, one of the things that we want to do is first say thanks to some of our sponsors who have made M3 possible, give you a little insight into what they do. Take a look at this.
For over 50 years, MBF, the Medical Benevolence Foundation, has been engaged in a unique ministry. It is a ministry of connecting people and resources to create sustainable, locally owned healthcare missions in developing countries. These missions deliver not only quality patient care, but also an introduction to the gospel of Christ and spiritual ministry training for medical staff. MBF's impact is felt by individual and church donors, by churches in developing countries, by healthcare students and staff, and by the patients who receive spiritual hope and physical healing because of MBF.
More confirmation that that this is what God wants for us. I'm just really humbled to be involved with all of you, and thank you for giving me the opportunity.